Andrea Kane, and I am here with you to go over the Language of Medicine 12th edition by Davy Ellen Chapner for HSC 114. We are now looking at Chapter 4, and this is part of Week 2 in our syllabus. So let's see. We're going to be doing prefixes. Last chapter, Chapter 3, we focused on suffixes, and suffixes come after the combining form. And pretty much every medical term has a suffix, but only some medical terms have prefixes, and those come before the combining form. So let's take a look. Our chapter goals for this one are those basic prefixes and how they combine. We're also going to learn about RH condition as an example of an antigen-antibody reaction. So here we go. We've got some combining forms. Carpo, cisso, costo, cutaneo, dactylo, ducto, flexo, glosso, glyco, immuno, morpho, morto, nati. Ooh, we've got one that starts with an I. All right. So make sure you make a note of that because most everything has an O as its combining vowel. So when it's unusual like this one, you're going to want to take a note of it and try and memorize that particularly. Normo, oxo, pubo, sepso. Somno, sono, theo. Now notice here, theo, and then you have thelo. There's only one letter difference. So make sure you know the difference. And nipple has two combining forms, theo, theolo, and thelio. So watch out for that as well. Tenso, thyro, topo, toxo, tracheo, urethro. Now we've got some suffixes here. Crin, drome, fusion, gia, lapse, lysis, meter, mission, or oxia. Partum, phoria, physis, plasia, plasm. Plasia and plasm are two different things, even though they can both mean formation. They're typically used as different things. Nia, again, P before an N, you don't pronounce the P, it's just Nia. And again, P-T-O-M, Tom. Like symptom, you don't pronounce that P, symptom. Ptosis, again, you don't pronounce the T, or the P, I'm sorry, you don't pronounce the P in the front, you pronounce the T. So it's neatomtosis. Rhea, stasis, trophy. Some prefixes, a and an mean no, not, without. Ab is away from, add is toward you. So remember, ab is you're pushing away. Add, you're adding something, it's coming towards you, you're getting it. So hopefully that will help you. Feel free to use hand motions when you're learning these because sometimes that is very helpful. Anna, anti, and anti. Okay, let's stop here. Again, we've got ones that are spelled almost the same and they need to be pronounced differently because they are very different. Anta, like antepartum, before birth, antepartum, versus antibiotic, against. So just really watch those. Otto, by, Brady, cata, con. Contra, D, dia. Notice the difference between D and dia. They're spelled differently, but they sound very closely the same, so you're going to have to be careful with that. They mean different things. Dis, ac, endo, epi, u, x, hemi, Now, the next two I really want to pause for a moment here on hyper and hypo. You need to make sure that when you speak these two or you write these two, that they are very clearly different. Because how you treat a patient for something that is too much of something, hyper, is very different than you would treat a patient for something that is deficient, way less than, below, under, that type of thing. You could theoretically kill a patient by giving them too much or too little of a drug because the condition was incorrectly established or the order was written based on that incorrect medical term. So be very, very careful when it comes to hyper versus hypo. In can mean three things. It can mean not, into, and within. Fun to try and memorize that one. Infra, inter, and intra. Again, inter is different than intra, and intra is different than infra. So watch out there. Macro, mal, meta, micro, neo, pan, para. Pair, peri. Okay, pair and peri. There's a one-letter difference there, so watch out because they do have different meanings. So pair and peri. Watch out for that. Poly, post, pre, pro, pros. Watch out for pro and pros. Retro, sub, supra, sin, and sim. Sin and sim are used together interchangeably. They mean together and they are used at the same, for the same purpose. So watch out for that. Tachy, trans, ultra, uni. And now we have a quick quiz. Which term means a muscle that draws a limb toward the body? Ooh, I helped you with this a little bit earlier. Ab is away from the body. Does that help you? Help you figure it out? And then I'll leave you to figure out whether it ends in ER or OR. Which term means painful breathing? Painful breathing. Well, it helps if you know what breathing is. And that's the NEA, P-N-E-A. Breathing is NEA. So I'm going to let you take it from there. Hopefully that's enough of a hint. Antigens and antibodies. Oh, in this day and age of COVID and other vaccinations that are already developed, there's a lot of talk about antigens and antibodies, but we're going to focus on the RH condition. The background on RH condition. This is really in your book. It's well worth reading through. You'll run across this if you are a female and you have a negative blood type and they're concerned that your baby could have a positive blood type. And so it'll go through all of this. But what I want to talk about is antigens versus antibodies. An antigen is a substance that's usually foreign to your body that stimulates the productions of antibodies against it. Antibodies are the response to these antigens. They want to fight it off. So let's pretend an antigen is an invader. It's coming into the body, and in the response to this antigen invading your body is that these antibodies, they all come together to fight off whatever this antigen is. They're like a country that gets an invader and says, oh, we need to send troops to the border because we need to stop this invader or we need to contain this invader. And so if you think about that, that's a good analogy for antigen and antibodies. And I don't mean anything political by this whatsoever, not going there. Just want to talk about antigens and antibodies. So the RH condition is an antigen-antibody condition that develops when there's a difference in the RH blood factor between that of the pregnant mom and that of the baby. And you're looking at an RH negative mom and then you're looking at an Rh positive baby. And here's a good visual to help you through Rh condition. And I'm not going to linger here because it's in your book, but you want to make sure that after that first pregnancy, for sure, that there's the antigen. You get that antigen passing, and the antibodies really attack on that second baby. So antibodies are made by what type of cells? Ooh, this is tricky, but it's in your book. I will give you a hint here. You can definitely know that they are not made by a clotting factor. Does that help? That should knock out 2 of these answers and make it a little bit easier for you. All right, closer look, congenital anomalies. These are an irregularity in a structure or an organ that an infant is born with. Something happens when the cells are being replicated, when the baby is being developed, and that's when these congenital anomalies occur. Some examples might be that baby could have some webbed fingers or toes called syndactyly. They could have some heart defect. They could have clubbed feet, those types of things. Some congenital anomalies are hereditary. You can actually see them in families. They go through the DNA and it's just inherited. Others come because of factors that are present during the pregnancy, such as fetal alcohol syndrome. That's where a pregnant woman drinks high levels of alcohol, and that results in physical or mental or both birth defects for the infant. So recombinant DNA, that's where you're taking a gene from one organism and inserting it into the DNA of another organism. That's the type of technique that's used to manufacture insulin, and it's done outside of the body. And CRISPR is an acronym for a technique that changes the DNA sequences, turns off genes, or replaces them with new versions. And again, I'm not going to spend a whole lot of time on here. This is really more FYI. Syndromes. What is a syndrome? It is a group of signs or symptoms that are commonly occurring together and indicate that perhaps a particular disease or abnormal condition is present. You may have heard of autism spectrum. At one point, that was thought to be a syndrome. There are many others, but one that is concerning for children is Rye syndrome, and that is characterized by the symptoms of vomiting, swelling of the brain, increased intracranial pressure, hypoglycemia, low blood sugar, and dysfunction of the liver. It may occur in children after they've had a viral infection that was treated with aspirin. And so that's why they encourage you that if you have a child and they have a viral infection, that you do not treat them with aspirin, that you treat them with ibuprofen or acetaminophen, something like that, but not aspirin, is because of the concern of developing Rye syndrome. And now they wanted to take a closer look at a procedure called a TURP, transurethral resection of the prostate gland. Prostate glands are only in males. This is what happens is the prostate, I can't speak, sorry, gland becomes enlarged and they need to resect it. So what do? They remove a portion of it through the urethra. And typically when they do the procedure, they do it because a man is having difficulty urinating. The prostate gland is squeezing off the urethra, and so that's why they've got to go in and do this procedure. Ultrasound. Ultrasound is really super cool. We're typically most often hearing about ultrasound when it has to do with babies and with pregnant moms looking at the growth of the baby and that type of thing. But ultrasound is used on all different parts of the body. It uses those waves to produce an image or photograph of an organ or tissue. An echocardiogram is an ultrasound of the heart. Make sure that you know that. Echocardiogram is an ultrasound of the heart. And then a sonogram is a fetal, a baby ultrasound image. And I personally think it takes a tremendous amount of ability to read and understand ultrasounds. I've seen those images before, and I have to admit I am not an expert at all in identifying the different parts and shapes and structures, but those who work in radiology, specifically in ultrasonography, are amazing at what they can see and visualize. All right, well, that is the end of chapter 4. So this finishes week 2's lectures, and I will be back again at some point to talk to you about week 3 and chapters 5 and 6. Take care.